going to show you guys how to work with the patient, how to get them up and out of a wheelchair into a walker and have them walk, turn around, come back, and sit down in the wheelchair. So we're just going to go through some of the basics. First, we want to make sure they have a gait belt on. And once we have that on, we are going to, first we're going to demonstrate to them how we're going to use a walker. Don't want them to be doing any of the things before not being shown how to do it. So the patient we're working with is a 67-year-old female, and due to her past medical history of osteoarthritis and just due to her age, we're going to be using a walker rather than a cane or crutches because it will provide a wider base of support. And furthermore, we're going to use a walker that has wheels on it because that will allow her greater mobility. But we also have to make sure that at home she doesn't have any thick carpeting that would prevent her from using the walker with the wheels. So that's why we're going to be using the walker, due to her age and also to her osteoarthritis, past medical history. So we're going to show the patient. First, we're going to show them how they're going to set up the walker. So this is already set up, but we want to show them how we're going to fold it up. So with this walker, you simply have these two little buttons here that you're just going to press down. So you press one of them down, you fold it in, and press the other one down and fold it like that. So if they want to carry it around, they can just carry it like this or like this, whatever is preferable to them. And then in order for them to lock it in place, you just simply do the opposite. Swing it out, and it locks on its own, swing it out, and it locks on its own. Now to adjust the height, down here you have these, I don't know if you can see on the camera, these little notches, and you basically just push the pin in, and then you can raise it, and it'll click like that. And that way you can adjust the walker to the appropriate height for them. Like that. And so
we are now going to go into getting Trey standing up. We are going to move this out of the way real quick. And make sure that your brakes are on your wheelchair, because when they go to stand up, you don't want the wheelchair going back. And then Matt and I are going to move the leg rests.
Make sure you have good control of their foot, especially with the patient with the left hip fracture. You don't want to just let their foot fall down.
Okay, so when we go to stand up, we are going to have one hand, each of us, on the back of the gait belt holding, and then one hand in front of the shoulder. And we're going to have two people, since I have an aide on each side, but if you're with just one person working by yourself, usually you can go to the strong side and hold and guard, but research has shown that it may not matter.
Right.
So whatever your preference is as a therapist. So Trey, what we're going to have you do is scoot up in your chair to the edge, and then you are going to put one hand on each armrest. And then what I'm going to have you do, don't do it yet, because we're going to do it with you. When we count to 3 and say go, you're going to push up through the armrest, stand up all the way, and since your weight bearing is tolerated, you can put as much weight as you want on your affected left side, or you can put majority of it on your right. And once you are standing fully, move one hand at a time to the walker. Do you understand?
Yes.
Okay, so Matt and I are going to guard you, and we're going to say 1, 2, 3, up, and when I say up, you stand up. All right? 1, 2, 3, up. Good. And now that you have them standing, this is when you would fit the walker to them. This walker is already fit to Trey. But to fit a walker, you want approximately 20 to 30 degrees of elbow flexion. You don't want their elbows all the way straight, and you don't want them hunched over with too much elbow flexion. You're going to want the handle at the wrist crease or the greater trochanter, which is a bony prominence below the hip on the side. So since this is already fitted to him, we're going to have Trey sit back down, and then I'm going to show him how to do a 3-point modified gait. So to sit down, reach one hand back at a time for the armchairs, and sit. Okay. So we're using a 3-point modified gait because Trey is weight bearing as tolerated, so he can put some weight through his left leg. If you were non-weight bearing, you would just use a 3-point, but to do a 3-point modified gait, you are going to do the walker first, then affected side, bring your unaffected side 2. So since it is the left side, you do walker, left side, right side 2, walker, left side, right side 2. And then when we get him up and get him walking, when he is going to turn around to go back to the chair, you are going to pivot towards your strong side, so that would be the right side in this case. So you would pivot like this and then walk back. Trey, do you understand that? Do you have any questions?
No.
And before you get your patient up and walking, make sure that they understand, and in some cases you may want them to repeat back to you what you have told them, because they may just be saying, yes, I understand, and they don't.
Right.
So Trey, we're going to stand up again, and then we're going to do that walk gait that I showed you. Okay, so scoot up in your chair. All right.
Grab the armrests.
1, 2, 3, up. Grab those. All right, so now do your gait. Left, right, left, right, left, right, left, right, left, right. Now we're going to turn towards mat side.
Small little step. Good.
And we're going to go back. Turn towards mat side with small steps. And then to get back to the chair, just slowly back up until your knees hit the side of the chair. Okay, and like we said before, one hand back, and down.
And that's
That's all we have for you today.